Hi everyone, Dr. Nemechek here. I want to talk about leaky gut and how there can be two major forms of leaky gut happening simultaneously. Now, so leaky gut, let's talk about that. Small intestine, you got a tube, okay? You got a tube. And what we've known most about in the last several decades is if you have excessive bacteria up there, that bacterial load is more than what the small intestine is designed for, and fragments of bacteria will literally leak through the seams. So like you have these cells abutting, will leak through the seams, and in the tissue just surrounding the small intestine, they estimate it's upwards to 70% of all the white blood cells in your body. So you leak like fragments of bacteria right into the immune system. That's going to react against that because the immune system's there to protect you, and boom, huge inflammatory release. And now we use rifaximin to remove those bacteria, and then the leak stops and the inflammation goes down. And then, as we talk about the protocol, wide range of neurological things can start to improve. There's another form of leaky gut I've talked about in other videos about with COVID. Now, COVID, instead of this leak between the cells, COVID looks like in some people is causing, clusters of cells to die. So you got at least from a molecular level, a big gap, and tons of stuff can flow through there. Okay. And in our kind of slow experimentation and trials using glutamine, so we've had, for instance, a number of kids and adults who are recovering very nicely with rifaximin. They get COVID, and then we realize in this time frame afterwards, the 3-6 months later, there's been no progress, even though the rifaximin was working before. And now we know there's no long-term resistance to rifaximin, so it wasn't that the rifaximin suddenly failed. All right, something happened after COVID, and they reported this about a year ago. The description of finding these big holes in the small intestine. Now, interestingly, this is what happens in HIV, and I did work involving glutamine in HIV patients back in the 90s for this very same reason. And so what we've seen now in our patients is we've had people who are recovering well with rifaximin. And so that means the leaky gut from this stopped, the rifaximin worked, they get COVID, they develop, boom, the big gaps, a second type of leaky gut, even though there's no bacteria up there. But there's other material that's going to flow through there, okay, and ignite the immune system. And we give them glutamine, and whoop, they heal up, those cells heal up, and they start to recover again very nicely. In some cases, it's been dramatic, both in kids and adults. Now, we had one nice, interesting case where they're on both now. They need both rifaximin and glutamine to recover, and they stopped the rifaximin, and they started getting worse. So it means the bacteria came back, they got that leak. And then I've had a case where a woman needed both rifaximin and glutamine to recover. She stops the glutamine, started getting worse. So these cases are telling us that these patients have two independent causes of of leaky gut. One from bacterial overgrowth that you tend to treat with rifaximin. The other from these, what we call apoptotic phenomena. That means cells dying in post-COVID patients. And that we treat that with oral glutamine supplementation. And the glutamine dose is a tablespoon twice a day for adults. So both of these can happen together. Now, once things are improved further enough, what happens is you can stop the glutamine and they don't do worse because the inflammation's way down and the need for glutamine decreases. All right? And then you go further, you can stop the glutamine or the rifaximin and they don't relapse right away. They may relapse just every several months, 6 months, 4 months, They get their symptoms and they just take a short course of rifaximin then. So both of these are happening together. Hope that's helpful, kind of just a little thing I wanted to talk about. We'll have some more videos on glutamine and POTS and some other things like that coming up. Take care now. Bye.